A young adult patient comes into the clinic with chronic pain in the shoulders and back. They've had multiple hospitalizations for episodes of severe pain, which seem to come and go. This time, though, it's the right shoulder that's been bothering them, so we get a chest x-ray to check for any abnormalities. The first thing I notice on the x-ray is cardiomegaly, an enlargement of the heart. While this can be seen in a variety of conditions, it's definitely something we'll need to consider in the context of the patient's symptoms. But what really grabs my attention is the density of the bones. These bones are unusually dense for someone of this patient's age, and that's a key finding we need to explore further. Now, when I take a closer look at the right humeral head, I notice some irregularities. There's evidence of a vascular necrosis. This is where the blood supply to the bone is disrupted, leading to the death of bone tissue. It's not uncommon in patients with chronic conditions that affect blood flow, but it's still concerning and adds an important piece to our diagnostic puzzle. One more thing. As I scan the left upper quadrant of the abdomen, something seems off. Where we would usually see the spleen, there's a conspicuous absence. This raises the possibility that the patient might have functional asplenia, which could tie into their overall condition. Lack of spleen function can leave the patient vulnerable to infections and also points to certain chronic systemic diseases. So what's the diagnosis here? Putting all of this together, the cardiomegaly, the dense bones, the avascular necrosis, and the missing spleen, this constellation of findings is highly suggestive of sickle cell anemia. This is one of those cases where the radiographic features provide a clear, almost classic picture of the underlying disease. Sickle cell anemia can lead to a variety of complications due to the abnormal shape and function of red blood cells. These cells can block small blood vessels, leading to episodes of pain, bone infarction, and even damage to organs like the spleen, which is often seen in chronic cases. This case is a reminder of how important it is to recognize these hallmark radiological signs because they can tell us a lot about the patient's underlying condition, often before any additional tests are performed. Thank you for joining me in this discussion. If you enjoyed this breakdown and want to dive deeper into fascinating radiology cases like this, don't forget to subscribe to Radiology Made Easy. And if you'd like to support us in continuing to bring these insightful case studies, check out the Buy Me a Coffee link in the description below. Your support makes all the difference. Thanks again for listening, and I'll catch you in the next case.